I'm Dr Kristopher Thurecht from the Centre for Advanced Imaging and AIBN at the University of Queensland, and I've got a novel concept award from NBCF. So I decided to work on breast cancer, mainly because breast cancer affects almost everybody in Australia. Everyone knows somebody who's been affected in some way by the disease. And so as a scientist, I'm driven to try and understand mechanisms or underlying mechanisms of disease. And in particular, breast cancer is just one that really does affect us. So the problem with metastatic breast cancer is that the disease itself is very different to the primary tumour. So metastatic tumour cells often express different proteins on their surface. And what this means is that we can't treat them in the same way that we treat primary tumours. So for women, often they've already gone through very terrible chemotherapeutics or radiotherapeutics to treat the primary disease. In many cases, the primary disease has been cured. But then in a couple of years' time, they find that metastases have popped up, and these can't be treated in the same way. So it's very hard to diagnose, and for women, they need to go through all of the treatment therapies again. So my research and my team's research really tries to address this problem by looking at early diagnosis. The key to treating metastatic breast cancer is finding the disease at a very early stage, often before it can metastasize from the primary tumour. So our research is developing new techniques and new materials that actually can diagnose and delineate tumour volumes at a very early stage in the disease process. So my group approaches the problem of metastatic disease by looking in a field called nanomedicine. And what nanomedicine does is look at very small materials that we can modify in different ways to either act as a diagnostic and improve our ability to see tumours, or to have a better way of delivering therapeutics to the tumour. So one of the biggest problems with current therapeutics for all cancers is the side effects that often occur. So our research is very much looking towards targeting the therapeutics solely to the tumour, so you don't get this accumulation in other organs in the body. So we're really planning on decreasing this effect of this terrible effect of the side effects that often come along with chemo and radiotherapy. So the biggest challenge for me and my team in developing techniques to treat breast cancer is actually the disease itself. So what we find as we research more and more into the disease and delve into it is that often problems are greater than what we originally thought. So we might come in with a grand plan to design a therapeutic to treat the disease in a certain way, but as we make that therapeutic and test it, we find that it doesn't work how we thought it would, and in fact the cancer can find a way around our treatment strategy. So that's the biggest problem, it's the terrible disease itself. So NBCF funding is paramount to our research. Without funding, we really can't do anything. Funding from NBCF provides support for postdocs and researchers to help me do the research. We also have support in terms of intellectual support from the NBCF to push our research forward. So the biggest breakthrough in breast cancer research really and undoubtedly is just the simple screening. Screening saves more women's lives than any other research in breast cancer, and whether that be a simple mammogram or an MRI scan, you always can pick out tumours at a very early stage, and really you don't need to progress to the later stages of the cancer if you can pick them up early. So I guess the biggest breakthrough that we've had in our research is with my collaborators, Rakesh Vidhu at Curtin University. So with Rakesh, we've come up with a small molecule that targets very precisely the tumour microenvironment, breast cancer microenvironment, whether that be in a primary tumour or a metastasis. So by coating our materials, our nanomedicines, with this small molecule, we're able to really accumulate a high concentration of therapeutics in the region of the tumour. In doing that, we can overcome a lot of the problems I spoke of earlier in terms of chemo resistance and side effects for women being treated with cancer. So I'd like to thank the donors, supporters, fundraisers for the NBCF, because without funding, then we certainly couldn't push our program forward. And certainly without the support of NBCF, I wouldn't have my research team focusing on breast cancer.